Welcome back to Washington Journal. We're joined now by Representative Kim Schrier, a Democrat from Washington, member of the Energy and Commerce Committee, and also Congressional Doctors Caucus co-chair. Representative Schrier, welcome to the program.
Thank you, Mimi. I'm really glad to be here.
So this week, the Senate is voting on a $9.4 billion rescissions package that passed the House last month. All Democrats, including yourself, voted against it. Can you talk about why Democrats are opposed to this and what impact you think it'll have?
Well, first of all, before we even get into the details of what is in the rescission package, I just want to make clear that fundamentally this is problematic because rescissions means cutting. And what we're cutting is funding that Congress, in a bipartisan fashion, so Democrats and Republicans agreed that we should be spending taxpayer dollars wisely and in certain ways. And we came together, thinking about our states and our districts, and made these decisions. This rescission package now comes in and says, well, Congress, you thought it was important to have foreign aid, now we want to cut it. Well, Congress, you thought it was important to have public broadcasting so that everybody in the country could hear unbiased news for free. Without commercials, and now because the president wants to cut it, we're going to cut it. I think fundamentally it is wrong because it is taking away Congress's power of the purse, and I think that substantially it is wrong because it's cutting things that are really in my constituents' best interest.
So what impact do you think these cuts, if they go through, will have?
Well, first of all, look, PBS stations in some areas will do just fine. They have funding from their communities. But in other areas, in rural areas, sometimes this is the only source of real news. And in the case of news and emergencies, it will take that source away. So it is damaging to information, to democracy, and to safety. And then with regard to foreign aid, I think sometimes people don't understand that foreign aid is a big part of our own national security. And so, for example, if they end the PEPFAR program, this is the program that was able to successfully combat AIDS in Africa. If we take that away and AIDS comes back in Africa, it will spread to our shores even more so. And frankly, the virus could mutate so that current treatments don't even work. So I just feel like this is really short-sighted. And again, Congress agreed this was an important program. And now this president and a very compliant Congress is willing to take it away.
And Representative Kim Schrier is with us for the next 15 minutes. So if you'd like to get in a question with her, please call now. Democrats are on 202-748-8000, Republicans 202-748-8001, and Independents 202-748-8002. Congresswoman, as a doctor, I want to ask about the One Big Beautiful Bill and your concerns regarding health care in that bill.
Well, again, fundamentally, when it comes to this, I'll call it the big ugly bill. Fundamentally, it is a shift from funding that takes care of the people in this country who are most in need, and it transfers it to a gigantic tax cut for the wealthiest people, the Elon Musk in this country. And the vast majority of those dollars are actually being sucked out of health care. It is taking Medicaid health insurance away, and in total will take health care away from about 17 million Americans and transfer that to the Elon Musks of this world. And I think that is morally bankrupt. And when I think about what that will do to our healthcare system writ large, when you have that many people who now have no health insurance, go to the emergency room for their health care, cause long waits in the emergency room, drive up prices for everybody, and send our insurance rates higher, in addition to closing rural hospitals, this is going to be catastrophic. And again, the point of this is not fiscal responsibility. This explodes the debt, and it transfers that money to the wealthiest who don't need it.
And regarding work requirements in Medicaid, Speaker Johnson has said 20 hours a week is not burdensome for able-bodied people. They could work, they could look for work, they could volunteer if they can't find work. Are you against that provision in the bill?
Well, here's the thing. It's clever wording. I think most of us would agree that if you are able-bodied and you can work, you should be working. That is just part of our responsibilities to ourselves and to our communities and to our families. The thing is that this is really not about helping people work. I mean, the vast majority of able-bodied people who rely on Medicaid already work. This is about paperwork. This is about making everybody, if they are taking care of a child, if they are taking care of an elderly parent, if they are working, if they are doing gig work, you name it, they have to get paperwork done at least every 6 months to prove that, or they fall off the rolls and it becomes very difficult to get that insurance back. And so I just want to be clear that when they've tried this in various states, what has happened is that the vast majority of people who are kicked off of Medicaid are eligible. They're working, they're taking care of their families, and they just messed up on the paperwork. And so, they're using those words, and we all agree that people ought to be working, but this is draconian and hurts people who already are.
And you're the first pediatrician elected to Congress, so I want to ask you about the measles cases hitting a 3-decade high in this country. Your reaction to that?
Well, it's outrageous. And frankly, I lay the responsibility for this at RFK Jr.'s feet because, well, even before becoming our Secretary of Health and Human Services, which is absurd because he is the least qualified, he works against our public health, he's been for decades sowing misinformation and distrust about vaccines. He's been making parents wonder about whether they should protect their children against really serious illnesses like measles, but let's not forget things like polio that will also come to our shores if we do not fully vaccinate children. And now we have people getting terrible illness. I mean, people suffer with measles. This is not just like a little rash. These are high fevers, suffering kids, crying. The rash is just a part of it. And they're suffering, and some have died completely unnecessarily because of misinformation from our Secretary of Health and Human Services. Just think about that for a moment.
You said, quote, that he should be held responsible for, quote, every death from a vaccine preventable illness.
Yeah, I do believe that. Again, this is not just his time as Secretary of HHS, when he's brought the fringe into the government. I mean, he's bringing these conspiracy theories and outrageous, disproven thoughts about damage caused by vaccines, which have been proven untrue. They are safe and effective. He's brought that here in the last 6 months. But the thing is, again, for decades, he has been spreading misinformation. And that has led to decreased immunization rates and the ability for these diseases. Measles was eradicated in the year 2000. It has gotten a foothold again in this country because of his misinformation.
Congresswoman, he has replaced his vaccine board, as you know. What do you know about the new vaccine panel, and would you trust their recommendations?
Oh, well, this is outrageous. So the Advisory Committee on Immunization Practices sits down in a deliberative way. They look at the evidence of vaccines that have been approved by the FDA, so then we know they are safe and effective. And they have deep discussions about the science and decide which vaccines to recommend on what schedule for which people. And this is a very thoughtful process. Their decisions then influence whether Medicaid, Medicare, your insurance company, whether they pay for those vaccines, and also whether schools require children to get those vaccines. So the impacts are important. Traditionally, the people on this committee have been vetted for 18 months on average to make sure they have the expertise, the experience, the credentials to really evaluate the science. And he summarily fired all 17 of them and quickly replaced them with 7 people, most of whom have very clear, long-standing ties with the anti-vaccine community. Again, bringing the fringe into the government, getting rid of the scientists, and creating a situation where even physicians cannot trust what is coming out of this new ACIP. And so we're going to be turning to other places like the American Academy of Pediatrics, or the family practitioners or internal medicine docs in order to get the real truth, and going to have to work hard to make sure that we can give real truth to our patients and get them vaccinated.